I don't think I have had a patient hate their filler.
Ask us all the questions. Ask us how many trainings we do per year. Like, make sure that we're right for you, because like this is your face.
We know we lose 1% of collagen per year, early 20s all the way till the grave. So
people gravitate more towards biostimulators or quote unquote these natural fillers, but they're not reversible.
Yeah.
Hyaluronic acid is reversible.
I think mentally we kind of need that instant gratification sometimes. Welcome to Fill and Tell, where we spill the tea on all things aesthetics.
We're your hosts. I'm Megan.
And I'm Lauren.
We're here to give you the inside scoop on what goes on behind the treatment room door.
From filler to facelifts, skincare to aesthetic secrets.
We're taking you behind the scenes of the industry with unfiltered conversations, expert insights, and maybe a little gossip along the way.
We are back on the podcast today. We're talking about filler versus biostimulator. The greatest debate sometimes I feel like in aesthetics is which is better, which is worse. What do you need? What do you not need? Do you need both? Do you need either? And need is a relative term here. I don't feel like we probably need any of these things, but we love them.
Yes, we do.
And they make me feel happy.
They both do. You know what's funny is that filler, and we'll get into it obviously, but filler is reversible. Biostimulators aren't, yet filler gets a much more
terrible reputation.
There's so much fear-mongering around filler. There's fear-mongering around, I guess, the plane of Sculptra and getting a facelift after, but I'm like, patience, it can be dissolved. Well,
right.
If you absolutely hated your filler, we could dissolve it.
Which, let's talk about that for a second, because I was thinking about this earlier because I had a conversation with somebody that was like, no, I'm like, don't want to do filler because some of my friends have just looked really bad or had a bad experience and whatever. And I want to know, where are they going? What are they getting? I don't think I have had a patient hate their filler and I needed to reverse it. There has been a problem, a complication, an adverse reaction that we need to just tweak or fix. But for someone to say I hate it, I don't like it, I don't think that I've had that. And if I have had that, that patient never came back to see me again. And I never found out about it.
Yeah, I've never had that either. I've had one person say, hey, I feel like we just did a little bit too much in this medial portion of my cheek. Can we, and I've dissolved just the tiniest little bit but she's been so happy. Okay. I've never had anyone say they don't like their lips. Everyone is always like, wow, this made such a big difference, but no one has said anything. My boyfriend doesn't even know.
Right.
My patient yesterday, we've done her lip filler twice, and she said, my husband has never once said he noticed my lip filler.
Yeah, which is great.
And she's like, he just notices the bill, but he thinks this is all just Botox. And I'm like,
the most expensive Botox you'll ever get.
That's hilarious.
So it's interesting that people have so many bad experiences with filler. And I was listening to something else today, just giving you all my recent thoughts here, that somebody was kind of just going down this list of almost I don't know if it was a Facebook group or something like that. I was in a Facebook group once where it was a bunch of aesthetic injectors and providers, and I had to literally remove myself because some of the commentating and some of the questions, I was like, this all seems very dangerous.
Was it catty or
people don't know what they're doing?
Oh yeah, that would spiral me. I couldn't even watch the backyard Botox. I was commenting on every TikTok that I saw, and I was like, how crazy is this? People
really are in these groups asking for basic medical advice and knowledge, and they're treating people.
I feel like there's a few places in town that are like that.
Yeah, I think there are places everywhere
but
like that.
But that's what's wild to me, and going back to what you were saying, or not trying to interrupt, but first and foremost, before you even do filler versus biostimulator, and we will get into that, vet your injector. We always say that. Please go stalk our Instagram, ask us all the questions, ask us how many trainings we do per year. Make sure that we're right for you, because this is your face. I just find it wild. I had a patient come in and say She, right before her appointment, she walked into some place that's apparently new. I haven't heard of it, called like B12. It's right by Home Goods, but
Can you name a place that if
I
it's
think
a Medicaid, like it's
I think it was called B12. Like it
Is
basically
there not a trademark on that?
they do like shots and injectables
Okay.
and not injectables, peptides and maybe hormones. Anyways, she's never been there before. She walked in and she's like, the person's explaining, you know, what they offer, and she got like 10 injections. I was like, do you know
10
what you
peptides?
do you know what you got? No.
Do you know what it does?
And then she has the audacity to ask me, like, and say, like, filler's bad. You know, I don't know if I want filler. I'm like, ma'am, you just, like, you have no idea what you just got injected into your body. And, like, what type of growth signaling that could
Yeah. People are
cause.
super gullible, and it's almost like one or the other. You're like gullible, you believe everything and you'll purchase everything. Or you're on the opposite side where you're so skeptical that you're preventing yourself from doing anything because you've terrorized yourself with TikTok fear.
Yeah, yeah.
So if we could just get everyone back into like the middle ground where you go to your provider, doctor, injector, like this goes for all specialties, where you like this person, trust this person's credentialed, and you just start taking their advice. I think we could get back to like a much more harmonious like medical community.
Well, and I think I think it's great to just have an open mind with anything, though, like anything in life, down to, you know, from politics to injectables, right?
Yeah.
Like having an open mind, or like hearing what the other side has to offer and seeing if you align with it whatsoever. But I also think it goes down to, or like boils down to that, you and I, when we walk around, people would not be suspicious or suspecting that we've done anything because it looks really good.
Right.
So the problem is that all of your friends are walking around with Botox or injectables, but you have no idea that they've done any of that because it looks good, because it looks natural and subtle. But you see that one person that has really big lips or horrible cheek filler or a weird chiseled jawline, and then you cross it out for good.
Right.
So, yeah, I mean, just going off of what you said is like vetting your injector.
All that to say, we're talking about filler versus biostimulator. So the difference in the two. So filler, also known as hyaluronic acid, also known as dermal filler, contouring, facial balancing. I feel like there's a million terms that people use. I feel like a large amount of the injecting community has tried to get away from the word filler just because it was associated with this bad connotation. And so started using the terms hyaluronic acid more, hyaluronic acid injections, hyaluronic acid injectables, to kind of like remove the word filler.
I don't think I knew that. So should I be saying hyaluronic acid, or can I say filler?
I think you could, it's a free country.
Sure, but like, is the movement moving towards hyaluronic acid?
I think for some people, when they're explaining it to patients, they're removing that word because there's so much bad stigma associated with it. But I think at the end of the day, like, you should still know what you're getting.
Well, yeah, I know. I think that's the hard part, is like, I want to break it down for a patient so no nuance, so elementary level that they know exactly what we're doing.
Right.
But at the same time, I want them to not be confused.
Right. So there's a lot of words for it, though. It means all the same thing. Hyaluronic acid means a gel-like substance naturally found in your body. What we inject is not obviously naturally from your body. It's made in a lab. It's fermented. It actually comes from bacteria, the sugar molecule, sterilized, processed, all of these things. And then it's a gel. And there are different types of gels that we will use. But that's the most simplistic way to describe it. It's very biocompatible. So I don't know of anyone who is allergic to filler unless you're allergic to lidocaine, which is in filler.
Right. No, I feel like the only adverse event you would ever have from filler would be like a really severe autoimmune or something like that, where it creates a nodule, but that's not an allergic reaction.
Allergic though. So maybe I should go like do a deep dive on has anyone been allergic to filler?
I don't think that they have.
Yeah, there's a lot of lidocaine. There's lidocaine in most fillers, so you can be obviously allergic to that and have a reaction.
That's probably rare too, right? Someone being allergic to lidocaine. That's like someone saying I'm allergic to epinephrine.
Well, you can't be allergic to epinephrine. You make that in your body. Like, you cannot be allergic.
But people think if their heart races a little bit, they're allergic to it.
So. Okay, bring it back. Filler is a gel. It pulls in about 1,000 times its weight in water. So that's how we're able to volumize, right? Like, that's how we are able to fix a hollowed temple or correct a
tear trough.
Everything that needs volume, which at some point in time in our life we all need volume.
Yeah.
But this is the best way, I think, in order to get that improvement is by using a gel. You can certainly go in the way of biostimulators, but you're going to see that instantaneous response. You're going to see instant results. You're going to see it right away, and you're going to solve, quote unquote, your deficit problem, anatomical variant immediately.
And while all filler is, at least the dermal filler we're talking about, is hyaluronic acid, each one of them have different properties. And so there's a different type of rheology, meaning the firmness, the elasticity to it, the stretch, the amount of water it pulls in it. That's going to be different from one that we put in your lips to one that we want to fill a hollow temple.
Yeah, so a common question you'll get asked is, well, and we've gotten away from this, which I'm so thankful for in our practice, is really like getting away from syringe pricing, because there was a common, question of like, well, if we don't use all of this, can I use this somewhere else? Well, sometimes yes and no. A, do you need it? B, is it the right product though? And so I love our menu that we've created in our treatments because they're outcome based, right? Like, we want to get you to a certain outcome, and it doesn't matter the product or how much you're using or whatever. That's the that's the outcome we're looking for. So
yeah, we first started that, I think, probably with lips. We do a flat fee for lips, and rarely does someone ask me like, how much are you going to use, or can I use
from it a lot more.
Because it also allows us to use different types of
product
filler within one session, especially for lips.
Yes.
So,
and it's just based on like your goals and what your lip needs. Like, I can have 0.8 cc's, but you may only need 0.4. It really comes down to, we use this term, I think, like, and I think about this a lot, like, you're sitting at your hairdresser, like, you're not paying for the bleach, right? Like, I'm paying.
And you don't ask for the extra bleach in the bowl.
To go home with me.
Yeah, and you're not like, where can you put that extra bleach?
Right, because then you would look horrendous.
Thank you, Sarah, for not, like, using the extra bleach.
So no one is asking them, though, like, how much they're going to use or how much of this they're going to use. Like, because you don't know.
Well, and
you have no idea what bleach is supposed to do or what it's supposed to look like.
I have no idea. She goes and says these numbers to Carly about, like,
what to mix up.
I'm like, how do you know all that? Well, obviously she does it.
That's her job.
I know, but, like, same thing with us. Like, when someone asks me what filler that I'm going to use, and I really don't mean, like, I mean this respectfully, but, like, why do you care?
Right?
Like,
why do you care?
Do you genuinely know the entire Restylane profile? And if I said I'm going to use Restylane Kiss in your lips, would that mean anything to you? No. I 100% understand and agree with you just knowing to know in case you moved. Or, sometimes I'll even ask if someone has gotten filler for the past 5 years in their lips. I'm wondering, like, if they've had Juvederm before or something like that. And so, I didn't mean anything mean by that. I'm just saying, again, it goes back to, I would never ask Sarah what type of hair bleach she's using. Like, what's the brand? Because that means nothing to me.
No.
I trust her and that's why I go to her, because she's really good at what she does. She's professional. She educates herself. And so I feel the same way about someone coming to me as like, well, you're sitting here, so you must trust us a little bit. And then moving forward, definitely, like, don't get filler if you don't trust the person that is about to inject you.
Right. So,
and that moves into, like, choosing filler versus biostimulator, or when we suggest, which most people could benefit from both, whether their anatomy, again, like you said, needs some volume redistribution, or they need both volume redistribution and they have some skin laxity that we could use a biostimulator for. So
that'll get us into the next category then of biostimulators. There's two primarily that we use, which are Sculptra and Radiesse. We use a lot more Sculptra, or at least I do. I think you use more Radiesse, but I think you probably still use more Sculptra than Radiesse.
Yeah, I use more Sculptra than Radiesse, but it's funny that you say that because I was listening to Dr. K's podcast. She loves Radiesse.
Loves.
And every time I hear someone talk about Radiesse, it like intrigues me again, and I really want to start using it more.
I've had great results with it. I just really prefer it on a much thinner, more mature skin.
Well, in that, to be honest, the age-long debate of filler versus biostimulator, I honestly feel like there's a debate between Sculptra versus Radiesse. And you and I went to a conference and asked multiple surgeons, injectors, and no one really had
a great
answer.
No.
And so I think it goes based on preference, experience.
It does.
Honestly, like the relationship you have with your reps. But they've both been around a long time. I have a feeling Sculptra's been around a lot longer because it first came about to help lipoatrophy in AIDS patients, which is wild and really cool. But they both are fantastic. We use Radiesse primarily as a biostimulator in the neck.
Neck, chest, arms,
hands,
knees.
Décolleté.
Yeah.
So a lot of body uses for it.
And then I do like it on my, think about my, very mature patients, really thin skin, lots of sun damage. That skin quality for them is just not as good. I lean Radiesse in that regard.
There was a study that showed Dr. K was talking about this with Radiesse, at least. There was a 50% improvement in skin strength. I don't know how they studied it. Maybe it was a biopsy, and that was after actually 18 months. So all of that Radiesse, because there's a carrier, but when all of everything was gone, the skin still held its strength. Yeah. Which is obviously the goal, but just really cool that they have that study.
Right. So these two products we're using, like you said, skin laxity. So think about looseness to the skin, skin quality. So dull, lacking hydration, just doesn't look as vibrant. We know we lose 1% of collagen per year, early 20s all the way till the grave. So these are great tools to replace that. And they do give some subtle volume enhancements and subtle changes, but are certainly not going to make as big of a difference in volume as an HA.
Yeah, I would say you can think of it in terms of skin health and some volume loss.
Right.
Because skin health, because I feel like collagen, you can put that in the skin health category, and then volume loss, if you've noticed some changes in, if you're having a little bit of laxity or lost weight, etc.
Yeah, so you mentioned, it being a gel, or Radiesse is calcium hydroxyapatite. Bless you. Radiesse is calcium hydroxyapatite, which is a product, and then it has the gel substance in it as well, sometimes a little bit of lidocaine. You get that immediate, the nice thing about when you're doing Radiesse is you do get some immediate volume, and then that gel gets reabsorbed, and the calcium hydroxyapatite gets reabsorbed, and then you're left with collagen.
Yes.
So you do see a little bit of improvement, and then you're getting that long-term improvement over time. And then Sculptra is PLLA, poly-L-lactic acid. So just a slightly different molecule. It's collagen seeds, comes in a powder, you mix it with water. Again, you inject it, it disperses throughout the tissues, gets reabsorbed, and then you're left with this collagen fibroblast type of situation going on.
Yeah, so when Sculptra first came out, or maybe less recently, wasn't there a debate that Radiesse stimulates collagen 1, 3, and elastin versus Sculptra only stimulates collagen 3.
Mostly 3.
And that can be a little bit more inflammatory. So I think that's the biggest debate is...
But also now Sculptra is able to, has this gene function to where it turns on genes to actually make your cells healthier.
Oh, okay.
The gene study that came out with Sculptra.
Was that what we learned when we were in 30A with
That was like
Shelby?
right when that study came out.
Okay. But she was saying...
So it makes your skin actually healthier.
Yeah, so
similar to like BBL.
Yeah, that's really cool. Like, so it turns on a gene expression.
Yes.
It literally renews aged cells. That's really
so
cool.
Love that.
But so Sculptra, I think she said in that study she was talking about too that it stimulates elastin. No, or just Radiesse.
That study specific, I don't know.
I thought, yeah, okay. Anyways, why don't we use Sculptra in the neck?
I think a lot of people do.
Oh.
I think the skin's a little bit thinner there. You have a little bit of higher risk of certainly like some nodular formations. I think that, the dilution and the spread, that's really what it comes down to. And just kind of knowing those dilutions. Same thing with Radiesse though. Like if you don't have enough water and dilute it enough, you have a much higher likelihood of having a little problem. And that goes back to these things aren't reversible. They're difficult to treat. I've had little issues before, tiny little, bumps that form. And most of the time they're simple enough to just inject them with some saline and maybe like microneedle some of them and they'll go away. Mm-hmm. But if you end up with a real nodule problem, like it's difficult to treat.
Right. And again, that's what goes back to what I said in the beginning was like, I think it's interesting that people gravitate more towards biostimulators or quote unquote these natural fillers, but they're not reversible.
Yeah.
Hyaluronic acid is reversible.
But don't get me wrong, because I love Sculptra.
Oh, I am all for it. Here, my point in saying that was having the right injector, knowing what they're doing for both of them, even if one is reversible, is so key.
Right.
And it goes into the topic and the fear around if I get Sculptra or Radiesse, can I get a facelift down the road?
Yeah.
And we were at a conference with a facial plastic surgeon, like renowned out of Beverly Hills, and he said, absolutely.
Right.
The one thing that you want to think about and avoid is probably not doing it 6 months before your surgery.
Right.
However, he also said that his patients that have had Sculptra in the past, leading up to their facelift, heal better, have better outcomes, and if it was placed in the correct plane, then it didn't hurt his facelift at all.
So the fibroblasts, which are what you are trying to signal, live in the dermis and live on the bone. So those are the only two areas where you should technically be injecting these biostimulators, is where the fibroblast activity is. If you inject it into the fat, nothing is really going to happen, and you're creating this fibrous tissue into an area where it doesn't need to be. So dermis and bone.
Basically like top and bottom layers of our faces.
And not this middle part.
Which is
where your facelift happens. So your facelift happens in that SMAS layer. So you have to be, and it's hard to inject into that layer. Like it feels pretty gritty. So as an injector, I feel like if you're in that layer or not.
Yeah.
So there's room for both of these products in everyone's treatment plan. It really depends on your anatomy. What are our goals? What are we trying to achieve? Some of my patients start with HA and we get this immediate, and then we kind of layer some Sculptra on top just to give this longevity. Sometimes we do it all together. Sometimes I start patients with Sculptra, see the results that we can get, and then add on HA if we still have some deficits. But I think they marry beautifully together.
I do too.
And
I really feel like, even going through our treatment plans over the years, you've had Sculptra. I haven't. I definitely want to get it. There's no reason why I haven't. I just haven't.
Yeah.
But,
I'm ready for more.
Lauren has done Sculptra twice now, and we've done HA filler. There were areas for both.
Yeah.
Based on her anatomy, based on what goals she was looking for. I feel like after we did after
looseness.
we did Lauren's Sculptra last year, and she begs to differ because she doesn't think it was enough because we did a vial, but I feel like I had never seen her skin look better than she had both Sculptra, and then she did a series of microneedling with PDRN.
That was, I mean, a fantastic.
Yeah, and so we obviously we offer both of those at Due State, but yeah, no, I think it's
and that's what I love too about doing these together is combine your Sculptra because it's not that instant gratification that I do think is difficult for people, even myself. Combine it with your microneedling, combine it with your laser, combine it with other HA because it's going to work in the background, but then you see immediate benefit from the other thing you're doing. And I think mentally we kind of need that instant gratification sometimes.
Yeah, I agree.
So they marry beautifully together, and I think sometimes it's difficult for patients to wait.
That's why
it's a waiting game.
I love our microsculpt treatment because you're doing microneedling, which is basically instant gratification.
Yes.
I mean, in like 5 to 7 days, you're going to have glowing skin. But in the background, your Sculptra is working. So it's microneedling and Sculptra. And so 2 months, 3 months down the road, you're going to look in the mirror and be like, oh, I had a glow up and I don't know what I did. Yeah. It's your Sculptra.
Absolutely.
Okay, I hope that helped clear the air. I know it was a little bit.
I think that was a really good breakdown and a simple breakdown. Let us know if you have questions in the comments about HA, Sculptra, Radiesse. We're happy to answer them. Make sure to follow us on Instagram at the Fill and Tell Podcast. Subscribe on YouTube. Check us out. Come see us at Due State. And we'll see you guys next time.